Okay. Hi, I want to welcome comrades and friends to Workers' World's Party weekly webinar where we take on the burning issues facing the global working class and discuss strategies and interventions for building for a socialist revolution. I'm Betsy Piet from the Philadelphia branch of Workers' World Party. I use the pronoun she, her, and I am a member of the WWP Disability Rights Caucus. Tonight's webinar is particularly timely as we are less than 2 weeks away from one of the most contentious, dangerous, and inaccessible elections in U.S. history. Tonight, we will delve into some of the critical questions facing access to voting, both mail and in person, the COVID pandemic, and how the disabled community is impacted by all of these crises. More than 38 million people with disabilities, 16% of the US electorate, are eligible to vote. Just 12 days before the US presidential election, we find that disabled people are being targeted with voter suppression. It is now 30 years since the passage of the Americans with Disabilities Act in 1990, yet few politicians in the current election are addressing disability issues and concerns. In Philadelphia, one of the swing states, we're inundated with back-to-back political TV ads from both major parties, yet I've seen only one actually featuring a disabled worker. Hosted by the Disability Rights Caucus of Workers' World Party, this webinar will focus on the lack of support for people with disabilities to be able to vote. Absentee and mail-in ballots are not accessible in 43 of the 50 states. Fewer voting places will be open due to COVID, while only 17% of all voting places were barrier-free in the 2016 election. According to the Federal Election Commission, more than 20,000 polling places across the U.S. are inaccessible, depriving people with disabilities of their fundamental right to vote. Polling booths are often unintentionally, I was going to say unintentionally, but I think polling booths are often intentionally inaccessible. And this is something that has to be addressed. Voting obstacles can include polling places in a basement or upstairs without access via a ramp or an elevator, no accessible parking, narrow doorways that do not accommodate a wheelchair, etc. In most states, braille ballots are not supported, and people who are blind do not have the right to a secret ballot. That was from the ARC in Minnesota. The pandemic is teaching able bodied people what it is like to be disabled. Not only not being able to get around like you're used to, facing endless unemployment, being stuck in the house, finding ways to get food delivered, and speaking to family members and friends only on the phone, not in person. Commenting at the July 8th Workers' World Disability Rights Caucus meeting, Joni Marcourt said, quote, people are getting infected and becoming immediately disabled to some extent. If they survive, they remain somewhat disabled. The world population is getting a feeling of what it's like to be restrained by a healthcare crisis. This is the best time to talk about disability and to raise consciousness on it because we all have just gotten a taste of it in the last several months. Folks who are involuntary confined or in prison, in nursing homes, um, in prisons and other institutions now find themselves being trapped like sitting ducks for target practice by the coronavirus, sentenced to likely death without trial because their imposed environment has suddenly become a time bomb for this horrific disease. Our panelists tonight will address these problems and more while also raising how people with disabilities are organizing and fighting back. Now I would like to introduce my co-moderator, Judy Greenspan, who is a member of the Prisoners Solidarity Committee and also the Bay Area branch of Workers' World Party. Judy uses they and them pronouns.
Good evening, everybody. It is such a pleasure to be on this really important webinar. In fact, it's an honor to to co-moderate today's webinar. The issues of disability, COVID, and incarceration are incredibly intertwined under capitalism. And I will talk a little bit more about that later. But suffice it to say that you will be hearing from all the speakers about the connectivity of all of these issues as we move ahead to elections, but also as we move ahead beyond the elections. So I would like to introduce our first speaker, Susan Duha, JD, who is Executive Director of the Center for Independence of the Disabled of New York. The acronym is Sydney. She chairs the Association of Independent Living Centers in New York State. She received her law degree from Yeshiva University's Benjamin N. Cardozo Law School in 1990. Susan is herself a person with a disability. And Susan, thank you so much for joining us tonight. I wonder if you could speak about how COVID and lack of access have created a life-threatening situation for people in nursing homes, often making it a death sentence. Thank you, Susan.
Judy, first, thank you so much for letting me join you. It really is a pleasure, and I'm very much enjoying listening to the others who are going now to be part of this webinar. I want to talk about nursing facilities and people with disabilities. You may have read or listened to the news or social media about the devastation that the pandemic has brought to people with disabilities and older people through homeless shelters, jails, prisons, their workforces, nursing facilities particularly, and other adult facilities, mental health facilities, facilities for people with intellectual disabilities, and so on. When we look simply at when we look simply at nursing facilities, according to the New York Times, the death rate that's estimated for the pandemic in nursing facilities alone is more than 40%. So this is an extraordinarily high death rate in a pandemic that otherwise is disproportionately affecting communities of color, people who are Black and Latinx, and very low income communities. But the death rate in the community in general has been much, much lower. Nursing facilities were devastated from the very beginning of the pandemic, and you will have heard about, read about refrigerator trucks stacked to the roof with bodies, high death rates, staff using garbage bags as personal protective equipment, PPE, or having none at all. COVID-19 patients shipped from hospitals to nursing facilities that didn't have the staffing, didn't have the infection control, the PPE, or the ability to segregate people infected from those not infected to prevent further spread. Families were not able to see family members or even get information about them. People began wasting from a lack of care. And they didn't even have COVID. They had other conditions, but the staffing was so atrocious that it really affected everyone in the facility. And nursing facilities lacked transparency. The watchdog, the long-term care ombudsman program, couldn't go in. State inspectors were not going in. They were a closed box, and they didn't provide data for quite some time on infection rates and death rates. And even when the state began to require data, it wasn't reliable. It was self-reported. It didn't report residents who died upon transfer to a hospital as nursing facility residents who died. And it was entirely self-reported data. Facilities were reporting whichever data they thought they wanted to report, or they were not reporting at all. And we realized that what we were seeing as we worked with nursing facility residents and friends and family was just the tip of the iceberg for that reason. During the pandemic, residents have been devastated, terribly frightened. People have been discharging themselves against medical advice without a plan for services in the community, just to get out. People were calling my organization desperate to get out. We helped them, and we were able to get them services in the community and get them out, and often get them back to their families or into their own place. However, it was very, very difficult to do, far more difficult than without the pandemic, because you couldn't get a social worker or an administrator or an owner on the phone or a nurse on the phone. Messages were not returned. Discharge planning was halted for those seeking to exit. It was hard to get housing in the community when no one could go see apartments to inspect accessibility and to check for fair housing conditions. There was no plan to screen those with a place to go and the ability to put care in place in the community to get them out. During this period, our deinstitutionalization program at our organization alone was working with 158 individuals who died while they were in the process of getting out, working with us to get out. Their families were devastated, not able to be with them when they died, not able to go and see the bodies. It was shocking to people. It was just beyond belief. However, we were able to deinstitutionalize 150 people during the initial episode of the pandemic. And that was really an extraordinary accomplishment. We were just deluged with calls from individuals with disabilities and older people seeking assistance. Why was it so very bad? Well, conditions in nursing facilities were already horrendous before the pandemic. There have been long-standing unaddressed issues in nursing facilities. And in addition, the federal government loosened requirements for nursing facilities. The Trump administration decided the nursing facilities didn't have to ask people if they wanted to leave anymore, for example, but also there was significantly less reporting required. But there were other conditions before the pandemic that became extremely exacerbated when the pandemic hit. Infection control is an example. In May of 2020, a federal study found that 82% of nursing homes had deficiencies for infection prevention and control during a 5-year period prior to the COVID-19 pandemic, and that 2/3 of the facilities had infection protection deficiencies. That's what they call it when they're not doing well, in multiple years. Many didn't have infection prevention officers. That was just vacant. Staffing levels at nursing facilities have also been a very sore, long-standing issue, with turnover rates as high as 100%. And we saw this happen at a facility during the pandemic, where entirely new staff were brought in without supervision, new graduates, no idea what they were doing or what they were faced with. We really saw this exacerbated also during the pandemic because staff became ill at an extraordinary rate. They were going from facility to facility because their jobs at one facility didn't earn them enough to make a living. So they had to go to many facilities and work different shifts to make a living. So they became ill and they lost their positions. There were also illnesses in families of workers and childcare responsibilities with schools closed, and straight out fear of unsafe workplaces and completely unsafe working conditions. Before the pandemic, we also saw gaming of reimbursement rates. Nursing facilities would discharge Medicaid beneficiaries to get higher payment rates for Medicare beneficiaries. And during the pandemic, we saw that nursing facilities were further incentivized to do this, reimbursement gaming for higher rates, because higher rates were being paid for COVID patients taken in by nursing facilities. And so they would discharge Medicaid residents, often to congregate homeless shelters, and replace them with COVID-19 patients. And most disturbing was that in these congregate facilities, there's nothing like infection control. Staffing is grossly inadequate. Beds are ganged up together where you can reach from your bed across to the bed of the person next to you. And where the restrooms and other facilities, cafeteria, nothing is cleaned. So very, very difficult to avoid infection with so many high-touch surfaces that weren't being cleaned in these homeless shelters. We don't believe that discharge to a congregate homeless shelter is ever a safe discharge. But between March 13th and July 28th, we received a total of 50 involuntary discharge notices in our small program to shelters. Many times we were able to fight them and to prevent the discharges and get discharges to the community instead. But there were also many people who were discharged without our knowledge, because our program is so small. We're not in all of the facilities, and not all of the facilities were reporting these discharges, and there was no tracking of discharges to homeless shelters. Backlogs of complaints is another long-standing issue. And during March and April, we handled many complaints on staffing shortages, infection control, lack of communication, lack of PPE, and involuntary discharges. Many valid claims went unaddressed completely by regulators or were deemed unsubstantiated. Lack of personal protective equipment was another huge issue. Nursing facility staff reported to us that they didn't have adequate protective equipment. Residents wanted help, but staff were coming in without PPE, and then residents heard that the staff were infected and were compromised. It was just devastating for people, but also a long-standing issue with nursing facilities. Inspections have been another issue. Throughout, I guess, the history of nursing facilities, inspections have very often whitewashed what's happening in facilities and just glanced away when atrocious conditions pertained. For example, psychotropic drugging of people with dementia or other cognitive disabilities, so that people would be quiet in order to make up for the lack of staff to work with people individually. Residents were affected by this during the pandemic as well, because when inspectors finally began to do some inspections, they were doing inspections by video, or they were sending someone in, doing really scant inspections and finding nothing in the very facilities that we knew had deplorable conditions were the worst. We believe going forward that there are many issues that need to be addressed in order to cure this. First of all, we need community alternatives to congregate facility placement. And the default in this nation is to institutionalize people. That's the default. And it is very, very hard, despite the Supreme Court's Olmstead decision interpreting the Americans with Disabilities Act as saying people with disabilities have the right to live in the most integrated setting. There's very little attention to the need to close down facilities and replace them with community-based services.
Thank you, Susan. Thank you.
So thank you very much for listening, and I'm eager for your questions.
Okay, thank you so much, Susan. The work you're doing is critical at this time. And you remind me of my daughter-in-law who was in a physical therapy facility in March and April and facing many of the crises you're talking about. I think we want to slide from the People's Power Assembly. Do we have that? Okay. I'd like to introduce our next speaker. There we go. Okay. Um, Tareya Mitchell is an activist with the New York People's Power Assembly. The PPA has been instrumental in fighting for access for disabled people to the New York City subways. Tareya, how is the PPA involved in the movement for disability rights and for the protection of everyone against voter suppression and COVID?
Um, Thank you, Judy, for that question. And thank you, Susan, for your presentation about how folks in nursing homes and other rehab facilities have fared. I say that because two folks in my building were actually had like falls or accidents, and they were in rehab, AKA nursing home, to recover, and they died there. Well, one person left rehab to further recuperate with her sister, and she brought it from the nursing home, so she died and her sister died. So COVID, I live in a building, Celis Manor, for blind and visually impaired folks across all walks. So at least 6 people have died in my building, and a worker who had pre-existing health conditions also died. And she worked here, you know, for at least 30 years. So that was particularly hard. So we talk about how COVID impacts the disabled community. That's my old story. One of my former neighbors, he moved to an upper floor, he passed away. So to answer your question, I guess, so we've been doing mutual aid because when everything went into lockdown, there was like a run on shortages and some, you know, supplies of PPE, alcohol. So people would ask me, you know, because I was going out a little more than most folks, everyone, you know, was very afraid. Some people were robbed like the 1st of April or the 3rd of April in the building. So we started, PPA started doing mutual aid, doing grocery distribution. Like we would have someone shop for the groceries, we have separate people bag the groceries, and we have people bring the groceries over here and distribute the groceries like every 2 weeks, starting April until the middle of July. So folks have really been interested in that because we told them we would start it off again at the end of this month because we didn't know how the COVID situation was going to be, if we were going to have a second wave, and indeed we are. So we may go into some form of lockdown, like parts of area codes that are hotspots have went into partial lockdown. So we don't know how bad it's going to get. And also we were thinking about, you know, what's going to happen around election time. So we may need to recalibrate and expand our mutual aid, but we're going to start mutual aid again for Celis Manor. And we need folks for that. You know, when we first started out, folks were fearful and, you know, about, of course, because it was during the height of the pandemic. So you know, we're going to need people as we start up again. And we're talking about revolutionary work. We're talking about, you know, getting rid of this capitalist, patriarchal, white supremacist system. You know, we have to offer people a means to meet their needs, whether that's food. And we know we are a small organization, we're starting small, but we have to start somewhere because mutual aid is revolutionary work, is how we care for one another. And that's how we show people that we are serious about getting involved in community and helping folks. So if folks are interested, I'll put it in they can reach out to me. I'll put my email or the PPA email, and they can email me about that. But mutual aid is, you know, I'm not going to say it's easy. Once we got into routine that was easy, but it was always hard because it's a lot of work. It's a lot of work to do shopping. Maybe now it's not as onerous because you don't have the fear, and you kind of know you need to wear a mask, stand apart, you kind of have more information about this virus. But yeah, we still need people with cars to do the shopping, and we still need people to distribute. And we're trying to expand our mutual aid to include like set up a breakfast table a couple of times a week to help out the homeless in this area. There's a shelter, well, there used to be a shelter on 30th Street, but they closed it. So they have a walk-in area by that church over there between on 30th, between 7th and 8th. So if people don't know, we have a high rate of homelessness, homeless folks that come to this area. They're usually by the train stations or 23rd, or they are along 6th Avenue. And just doing like a coffee table or something, coffee, donuts in the morning to help them out. So I got some buy-in from the tenants in the building. So people also would want to help with that. Like I said, I'll put my name, email in the chat. So in regards to COVID and voter suppression, I think that my building kind of took part in sort of doing that. Voter suppression, I'm afraid to say, because they didn't let the Board of Elections hold the primary here during the summer. And a lot of people didn't want to walk over to another site to vote. So this year, this election cycle, they're gonna let the Board of Ed back downstairs for November 3rd. But that was pretty shitty of them. I don't even know how to say that, but the management of my building wouldn't even let us stage mutual aid in the community room. So that tells you the state of what they think about assisting the tenants. So PPA is also organizing poll defense teams to serve marginalized and other low-income communities, maybe mostly where Black and brown folks vote, for November 3rd. So if people are, again, interested, let me know. We're organizing teams. We're trying to get at least 100 folks so we can get to at least 20 poll sites. And, the more folks we can get, the better. So if you're interested. So Tony and I were talking about this. She actually came up with the idea, looking at what's going on in other states. For people who don't know, Tennessee and Colorado and Arkansas. Another state I heard about today, folks are showing up armed outside the polls, setting up tents to intimidate folks. So we don't think they're going to set up armed factions here in New York City, but you never know. You don't know if they conceal or carry, you don't know. And we think it's important because a lot of folks in those communities are disabled. We often don't talk about it. And I guess I'll use the hashtag disability so white, but when people think about that, they think about disabled folks as being white, but a lot of predominantly disabled folks in New York City anyway are Black and brown folks. So I think doing poll defense helps them. And I also think with folks, disabled folks in COVID, a lot of people are trying to vote early because they don't want to go to the polls. They're afraid to go to the polls. And there was a big snafu for the primary because they had some files that were supposed to be accessible to visually impaired, blind, and hard of hearing, and the file didn't work correctly. So hopefully they fixed that issue. They said they have, so we'll see. But historically, the Board of Elections, they've been pretty good the last 7 years. They've been really on it about making sure the ballot marking devices, they call them, are accessible. and making sure that there's enough room and have enough ramps and signage for disabled folks to come in and vote. And of course, there's always going to be something, but I will say that during the last, I guess, 7 years, they have been making more of an effort since they've been sued, of course, by Susan and other folks. So thank you, Susan, for that. But yeah, COVID and like we have early voting now, but we have vote by mail now, but that we should have had that in New York City, because a lot of folks have medical disabilities. A lot of folks may be temporarily disabled. A lot of folks may, for whatever reason, have a disability where they can't be used remote. So I'm glad that they have the early voting, mail-in voting available. But it's a shame that in our current political climate, the Orange Maniac, tries to discourage early voting, because that is great for a lot of disabled folks, a lot of elderly folks, a lot of folks, period. It benefits everyone when you make voting easier and not harder. And I know that's kind of the point, to suppress the votes of disabled folks, Black and brown folks. But democracy should be easier, not harder. So I'll just wrap up and say, if you're interested in the PPA's work with either poll defense again, or interested in helping with mutual aid, I'll put my name in the chat and my email to contact me. And I hope that folks are able to volunteer and participate. Because it's important to let people, even if we don't think voting will summarily change everything overnight or even over time, it's important that people will be allowed to exercise their rights. Okay, thank you.
Thank you so much, Tereya, for your talk. We really appreciate it, and we're very excited about what's being done in terms of election defense. And I'm sure people around the country are very concerned about it, around the United States. So before we continue, what I wanted to do is, Betsy and I are going to take turns. Right now, I'm going to read some things out of the chat, and a little later, Betsy will come on and read some comments in the chat. Let me say, first of all, if you have a question for the panelists, please put it in the Q&A, because that we're not going to read. It'll be in the Q&A, and hopefully that'll be apparent for people. There's an invitation from Zachary Borodkin, who is with the Disability Rights New York, and is telling people that there is going to be I guess a presentation or a webinar by Disability Rights New York on best practices during COVID-19 tomorrow at 10 a.m. I assume that's New York time. And he will be, or they will be co-presenting with their colleague. And he says, please email me if you're interested, zachary.borodkin@drny.org. Okay, so I do want to tell people that tonight's program is being live streamed on Facebook, and we're using Restream, and it's also being, it can be shared on Twitter and Periscope. So if any of you have any of those platforms, please help us broaden the impact of this. Let's see. Okay, and Susan had a comment. She said disability rates are higher among Black people, and Black and Latinx people have worse outcomes on health, education, employment, etc. because of racism and ableism as well. 75% of our staff and the people we serve are Black, Latinx, and Asian American, and our movement has had people of color from the start. Okay, and that right now, that's all that's in the chat, and Betsy will be reading later from the chat, and I will continue on with the program. So since its founding in 1959, Workers' World Party has had a disability rights caucus, as long as there have been Workers' World Party comrades who happen to have disabilities. The caucus has worked to promote inclusion and access for folks with disabilities inside and outside the party, and in the struggle for disabled liberation under our banner, "From each according to our abilities to each according to our needs," which was first written and stated by Karl Marx in 1875. We have attended conferences of disabled people's organizations in socialist countries, including revolutionary Cuba. The storming of the Moncada barracks in 1953, the opening salvo of the Cuban Revolution on July 26th, was the same date of the signing of the Americans with Disabilities Act in 1990. And the ADA was a hard-fought victory after so many decades of struggle by the disability community. Our next speaker is Kristen Turgeon, who is a member of both the Disability Rights Caucus and the Youth Caucus of Workers' World Party. Kristen, what concerns does the Disability Rights Caucus have in terms of voter access and health safety issues for the upcoming elections?
All right, thank you. And thanks for everyone for tuning in. Can folks hear me?
Yes, we can.
Excellent, just making sure. So hi, comrades and friends. My name is Kristen Turgeon. I use she, her pronouns, and I'm a member of Workers' World Party in the Boston branch. Voting has always been a hot topic, and in 2020 election, many people see it as vital. Every time you go online or turn on the TV or the radio, you hear and see PSAs exhorting you to vote. What has also thankfully come to light is voter suppression targeting poor communities, especially communities of color. This is not new, of course, but some people are hearing of it for the first time, and there has been a lot of action taken to try and fix the problem. However, one form of voter suppression is hardly being talked about. It is extremely hard for disabled people to vote. When I, a blind person, tried to vote in 2016, I was unable. I tried to request an absentee ballot and was told I had to fill out an application. But when I went to fill it out online, the website was not accessible with a screen reader, without which I couldn't use the computer. When I called the town office to report this and ask for help, I never received a call back. I'm not the only visually impaired person who was unable to vote. Absentee ballots aren't accessible in 43 states, with every state using a different system. Visually impaired people all over the country are struggling with accessibility challenges, and with COVID spiking in many areas, people don't feel safe going to the polls or having someone help them fill out paperwork that we should be able to fill out ourselves. We shouldn't have to choose between not voting or not having a private vote. Many polling places are also not accessible to wheelchair users or to seniors. Folks with developmental disabilities can and have also been barred from voting. This is not to say that this form of voter suppression stands alone. In fact, the opposite is true. Although all of these accessibility problems violate the ADA, administrations in some states are using the inaccessibility of polling places of communities of color to shut them down. This is both racist and ableist. Why didn't they just move the polling places to more accessible locations? This proves that the struggle against ableism is intertwined with the struggles against racism, sexism, homophobia, xenophobia, and all of our other struggles, none of which would be ended by voting. History shows us that real human rights are only won through the rising of the workers and the oppressed. That doesn't mean that you shouldn't vote if you feel like it's important. It also doesn't mean that the right to vote doesn't matter. I'm a socialist and an anti-capitalist. I don't feel that any real and lasting change can come from Joe Biden, and certainly not from Trump. Police brutality will not end under Joe Biden. Evictions and high rents won't end under Biden. The fascists aren't going to evaporate or leave the country if Trump loses. Change will only come when we, the people, fight for the world we want. A world in which everyone has food, a home, healthcare, a job, and an education. A world where those things are considered human rights instead of one driven only by profit. Then we will have free and fair elections, and the lesser of two evils will no longer be the best bad choice. Thanks, y'all. Build a workers' world.
Thank you, Kristen. Very, very good to hear from you, and very, very important comments. Um, I want to talk a little bit about the Disability Rights Caucus and how it came to be. One of our former leaders of the Disability Rights Caucus was wheelchair user Betsy Gimble, who was forced to leave her public sector job after her leg was amputated following being hit by a car. Betsy became a leader in the New York City disability rights community, assisting in a successful fight to win wheelchair lifts on New York City buses. She was also instrumental in helping make the May 3rd, 1981, over 100,000 strong march on the Pentagon against war, racism, and cutbacks, one of the first accessible for disabled people demonstrations in the history of the U.S. anti-war movement. No small, no small feat. You can learn more about Workers' World Disability Rights Caucus by searching on our website, workers.org, quote, disability rights, end quote, section. And you can contact our caucus anytime at drcwwp@workers.org. So we can work better together to smash ableism, racism, and all bigotry and oppression, and build a world where 100% access is a guaranteed right and not a privilege. Brian Shea, a Boston comrade on December 1995, represented Workers' World Party's Disability Rights Caucus in Havana, Cuba, at the first international conference on the rights of people with disabilities in the process of their social integration. It was sponsored by the Association of Cubans with Physical and Motor Disabilities and included international delegations from several continents. Brian is a contributor to our newest book, What Road to Socialism? This is a quote from his article. There are two important things to know about the struggle of people with disabilities in the U.S. First, we organized to lift the restrictions imposed upon us by the capitalist society. And second, we are people in isolation breaking through many barriers into the power of collective struggle. We are like the old Union song, the union makes us strong. You can find the book at workers.org/books, or you can download it for free, or you can purchase a copy, which helps us publish more books. Judy?
Sorry, everyone, I didn't leave myself enough time for transition to that one. Thank you so much, Betsy. I really appreciate learning about the early history of the Disability Rights Caucus. Well, Betsy and I work together on a lot of things in Workers' World Party, and one of them is the Prisoners Solidarity Committee of Workers' World Party, which is dedicated to bringing the voices and the struggles of the incarcerated or incarcerated siblings to you. And every week we publish 1 to 2 pages of articles. The page is called Tear Down the Walls, about the struggles of incarcerated workers, because we do believe that people inside the prisons and the jails and the detention centers are part of our working class and are incarcerated workers. They are our siblings who are in prisons, jails, and detention centers. And our party is fully committed to fight for the total abolition of this inhumane and criminal, and I mean criminal, not the way they talk about it, but the way we talk about it, that criminal injustice system. A very large percentage of incarcerated people are disabled. In many states, people who have felony convictions are not able to vote. In fact, many former prisoners, they first won and then lost almost within months their right to vote due to a recent court decision in Florida. They're always thinking of excuses so that people who are formerly incarcerated people who are primarily Black and brown will not be able to get to the polls. Voter suppression for people who have done time is nothing new. And prisons do little or nothing to make the incarcerated, live in an accessible prison. And we know there is little or no real medical care available to people inside. COVID has impacted our incarcerated populations significantly due to the fact that social distancing and adequate PPE are not available to people inside. And prisoners are routinely and punitively transferred between prisons. A recent outbreak at San Quentin prison was caused by such a transfer of incarcerated people. The prison system did little or nothing to control the virus and guarantee the safety of the people behind the walls. In fact, within weeks this past summer, over 2,200 prisoners became infected with COVID at San Quentin prison, which is also the prison that houses California's death row prisoners, and 28 died from COVID. The California State Appellate Court just ruled that the California Department of Corrections has to release or move, and the moving is the problem, 50% of the 3,000 incarcerated people in that prison. Activists on both sides of the walls are very concerned, and the families of the incarcerated are demanding immediate release rather than another unnecessary and dangerous transfer. So I just want to say a few words, and this graphic is going to be hard to look at except if you look at Workers' World Party newspaper. But the Prisoner Solidarity Committee of Workers' World Party has a set of justice demands, and we're not the only ones. Prisoners' rights groups and abolitionists all over the country have generated demands for prisoners. And we did on our Tear Down the Walls page. And it's an issue that impacts all prisoners, but particularly disabled, elderly, and immunocompromised prisoners. We are demanding the immediate release of this large group of the most vulnerable of our incarcerated siblings, regardless of their conviction. Should not be a question of, are you in for a violent crime? Are you in for a non-violent crime? The violence of the prison system far outweighs the so-called crimes that people inside are doing time for. With COVID and negligent medical care, all prison time now, similar to what Susan talked about in nursing homes, is now a death sentence. It's time to free them all, abolish the prisons, and use the money to fund people's needs, to fund schools and housing and jobs, healthcare, and other services to benefit people, not big businesses. And now Betsy, now to Betsy.
Thank you, Judy. I just want to make a plug for a campaign that Workers' World has to send free subscriptions to prisoners through Patreon. You can visit workers.org to find out about that. And right as we were getting ready to start this call, we got a call from one of the Pennsylvania prisoners who has helped us promote the paper. And we haven't been able to send a print issue to prisoners for several months now, since mid-March. We finally were able to get the first one out. And he called to say that all of a sudden he heard this cheering going on across the entire prison. And it was because the prisoners finally got their first copy of Workers' World. So that's a good way to really appreciate how important a political paper like Workers' World is. I also want to go back to a message that Tareya shared for all panelists. For mutual aid or poll defense, you can contact Tareya Mitchell at peoplespowerassemblies@gmail.com. And thank you, Judy. If you like what you have heard about Workers' World Party and would like to join or get more involved, please go to www.workers.org and fill out the form under Join WWP. One of our organizers will get back to you as soon as we can to talk further. And before I introduce our last speaker, I want to invite you to put any questions to the panelists in the Q&A at the bottom of the Zoom page, and we'll be answering those questions very soon. I'd like to now introduce our final speaker, Renee Imperata, a disabled transgender activist. Renee is chairperson of SAGE Advisory Council, Senior LGBTQ Center, a member of Workers' World Party and People's Power Assembly. After returning from the Vietnam War, Renee dedicated herself to organizing against the war inside the military and after. She is also active in supporting trans people of color released from prisons to secure housing. Renee, could you talk about how COVID and the voter suppression have impacted the many communities that you are involved with? Are you there, Renee?
Yes.
Okay.
Okay, so you don't want me on video, correct? Hello?
You should come on video, Renee. Thank you.
Yes.
Oh, okay. Okay. Hello?
Perfect.
I was
Perfect.
trying to get on my MacBook. I'm a bit of a dinosaur with all this. But I guess we could just do it on this iPhone. Can everybody hear me?
Yes. Looking good.
Okay, so just before I start, my pronouns are she and her. They're not of any other gender. So let's start. I believe I have 10 minutes, correct? Correct. So let me say this. I've been in the trans community basically since 1974. And I, how about this? I liberated myself from the spectrum of being an unconscious male impersonator in 1989. And I think most people know that the horizon for trans people is not the same horizon for others, especially cis people. And this is especially so for trans women assigned male at birth. There is a very, very, very special consideration when it comes to the personal safety of trans people who are disabled. For instance, let me give you my own sort of sad experience. I began to use a wheelchair, in 1998, 22 years ago. And let me just say that before that happened, I was pretty extroverted, outlandish, trans sex worker, frankly, until 98, when my injuries from Vietnam and the effect of Agent Orange, which brought on my neuropathy and aggravated the injury that I had on my left side. I'm also hearing impaired, and I'm also been a PTSD patient since 1996. So, what do you think it might be like for, say, a trans woman like me or any other who is in a wheelchair? Because I can tell you that before I was in the wheelchair, I always had weapons, frankly, to defend myself. And not too long after I started using both the wheelchair and crutches, a certain reality began to seep in. What is that reality? The reality is that when you are a transgender nonconforming or even person of no gender, because of your expression, because of how you appear in public, it's one thing to be prepared for any inevitability. I recommend that to anyone. However, when you go down the street, whether it's in your wheelchair or on your crutches, bigots will perceive you as having either very little ability to defend yourselves or no ability. And what that does, it leaves you open to intimidation. And here's the part that I don't like to talk about, but I will. It's very sad. But to be honest, after being harassed for a few months, I began to do something that I look upon with great sorrow. I began to modify my appearance to the point that I could appear as someone I am not. Simply because I didn't want to be beaten or killed. I have met quite a few disabled trans people in wheelchairs who had more mobility challenges than even myself. And it's a common topic. For years, and I mean years. Now, by the way, when I say I modified my appearance, I still was someone who stood out, sort of, from a general society, for lack of a better word. The psychological effect that has on trans people is beyond a complete way to express that. Because I have met, believe me, and helped trans women, especially of color, who have been beaten in their wheelchair. It is devastating to the psyche. and the confidence that one must have under capitalism to survive as a trans person. I will say this, as the years went by, I frankly decided that I couldn't do it anymore. You know, that, well, actually my daughter noticed that after about 4 or 5 years of modifying my appearance, I started to break out of that shell. I couldn't do it anymore. It was impossible. And my daughter and some friends said, Renee, I worry about your well-being because we're afraid you could be harmed or you could be killed. I very carefully explained the following: that if I modify my appearance in order to be viewed as something I am not, then they have already killed me. And so, in the ensuing years, you know, carrying pepper spray and mace, I just broke out of that shell. And myself personally, and went back to my my former realness. And I know it's risky. I get hostility. And I've actually, for me now, I'm only speaking for me. I'm not telling other people how they should deal with this. It actually made me feel freer to let those chips fall where they may and live the life that I am meant to live. I wanted to spend time on this simply because in the disabled community, trans people are not as represented, mostly, for many
Renee,
different reasons.
You
Am
have
I
about
over my time?
You're over your time. You have what, 1 minute to wrap up. You have about
Okay,
1 minute. Okay.
I'll wrap up like this.
Okay. Thank you.
Let me just say that this also goes for in the LGBTQ community, right? So what I really just wanted to bring to this webinar as a panelist is that the organizing for disabled rights and justice has to include and will be included in the liberation of all people who are disabled of any gender. I think I'll leave it at that.
Thank you so much, Renee. We really, really appreciate very much you coming on and speaking.
Thank you.
And sure. So we have come to the part of right now of, I think we got to change the spotlight. Anyway, we have come to the part of the program where we're going to ask all of the panelists to please please turn on their video so that we can have a discussion. We have a lot of questions that have come in and we'll see how many we can get through. And so hopefully instead of a speaker's view, we can do a gallery view. Great. So fantastic. So I'm going to start and then Betsy will fill in and we'll see where we go. And I'm going to, after I read the question, Uh, if no one's talking, jump in. And if you want to be put on stack, you can just raise your hand and we'll take our turn and see. So this one, the first question, and it came from the audience, and it's a very timely one. Many states are experiencing very long lines at the polls. And and they were concerned, as cases of COVID continue to increase, do you see a risk of the virus spreading during this early voting period or on election day? And I would add, what sort of deterrent is it going to be for the disabled community to have to stand on really long lines? I don't know if there are, instances where they brought out chairs or they've made it possible for people to rest out of the sun. So that's the question right now. So what's the impact of access because of these long lines at the polls?
Judy, if we could add to that, what connections can you make between lack of voter access for disabled people and voter suppression of Black and Brown communities in the U.S.?
Okay, sure. We could throw that one in too.
Okay.
Can I answer that one?
Oh, sure. Just jump in. Everyone will get a chance. Sure.
Okay, so I can't speak for other states. I don't think it'll necessarily spread in New York voting because I'm a poll worker, a seasonal poll worker, and I already took the class. So 6 feet apart, you can't even come in the polling site unless you have a mask on. And of course, I don't like cops, but the cops are going to be there at the poll sites. In case people don't know, inside the poll sites in New York City, there's always police officers there. So I can't speak for outside, but we will be putting the stickers outside so that people can stand 6 feet apart. But inside the polls, all of the employees and the voters will have to wear masks. Now, where infection might come into play again is with the freaking cops, because the cops don't wear their masks. So if they get a situation and the cop has to come in and they don't have their mask on, that could be a point of infection. The coordinator can ask the cop, the coordinator of that poll site can ask the cops to wear the mask, but the cops are going to do what the cops are going to do. And of course, if you get recalcitrant voters who want to make a scene, come in there and take their mask off, that's another issue. But so what I can say is that the poll workers, because I'm going to be a poll worker, and it was really hard for me to decide if I wanted to work November 3rd because you're inside 16 hours from 6 a.m. to 9 p.m. And I actually have to show up at 5 a.m. So yes, really hard as a person who's chronically ill and my immune system is deficient. So I'm going to be overly cautious. I already told my coordinator for the poll site that I might not be there for a couple of hours, to minimize my exposure in that one area. Sitting in that poll site for 16 hours, I can't do that. In relation to voter suppression of Black and Brown and disabled folks, I mean, that has been going on historically since, before Jim Crow, when Black folks couldn't vote and other folks couldn't vote, and then they didn't have any ADA provisions. And of course, is going on across this nation now, voter suppression, closing poll sites in Black and Brown neighborhoods, closing poll sites, like Kristen said, using the excuse of, well, this is not ADA accessible, instead of making it ADA accessible and keeping it open in areas that serve in Black, Latino, or other marginalized communities. So that is a thing that's always been going on, and the only thing we can do is that we can organize the poll defense team or election defense teams to prevent intimidation, and in as much as you can work within the system to demand you know, your politicians and your the stakeholders make these poll sites ADA, but this is an ongoing struggle because the goal of the other party is to suppress the vote. And if disabled folks happen to get caught up in that, oh well, too bad. And as Susan stated, that yeah, most of the disabled folks that she serves are, you know, Black folks and brown folks. So if they're disenfranchised, oh well. So it's just something that we have to fight against. That's the struggle. So what you can do to help, like I said, is, you know, bring a lawsuit, go to an organization to bring a lawsuit like Susan and her organization did, go to organizations that help disabled folks in your community, support groups either monetarily or volunteer that work on voter disenfranchisement. And yeah, that's enough for me.
Thank you. Thank you, Taraya. Do any of our other panelists want to chime in on this?
Tarek,
chime
you
in.
are incredible on this topic. I want to add that around the country there have been lawsuits to make polling sites accessible, and it's really critical to report if they're not accessible. We've been surveying polling sites every election day since 2002, and usually the inaccessibility rate is around 65 to 75. It's important to take precautions when you go to the polling sites to make sure you social distance, wear a mask, avoid touching common surfaces, wash your hands when you get home, and try to protect yourself from others, including the police, who are going to be there and who are not behaving, shall we say, and to report that non-behavior, that non-compliant behavior. It's very, very important. We need to expand voting online for people with disabilities. It's really critical. We do this for US citizens abroad. We do it for military. We could certainly do it here. And to make absentee ballot voting easier, although we really like to show up at the poll site, to be seen voting with our neighbors. And it's very important. These are critical instructions in areas around the country where there are spikes. And that's true of communities of color in New York City. We're having very big spikes. So, you know, it's really a cautionary tale. Look for non-peak hours to go to early voting sites. There are not enough of them. We need to advocate for more, as we have been doing, and keep up the fight.
Thank you, Susan. Kristen or Renee, do you have anything to add?
Yeah, I can chime in very quickly.
Great.
Just on the thing that you said about the deterrent to disabled folks coming out to vote, especially in this period. I don't know an enormous amount about the polling centers or how it's done in Massachusetts. I have not voted. 2016 was the first election I could have voted in, and as I said in my talk earlier, I could not. But definitely as a blind person, especially if I was going to the polls independently, not only would I not want to take a Lyft or an Uber right now or anything like that, just because what if the person sitting in the car before me did not wear a mask? I trust that the workers are wearing masks, but can't trust anybody that might get in the car beforehand or whatever. But also, people have a tendency, and I'm sure others on this call can share their own stories about it. If they see somebody with a disability, they automatically think, oh, you need my help right now. And they try to reach out and to touch you or grab you or steer you or guide you, oftentimes without ever asking permission. And people still do this, even in COVID times, when it's very obvious that there is a pandemic. We're all supposed to stay 6 feet apart unless, you know, you're living together or something. Why are you reaching out and like trying to guide me into a line right now. But I would think that, you know, thinking about the nightmare of a giant line with a whole bunch of people and getting into a polling place with other people who may or may not know how to, you know, help somebody with a disability and may take it upon themselves with good intentions but very annoying results to grab somebody and like pull them toward the booth or something, or steer them into a line. I'm not sure if that had a point, but that would be a deterrent for me as a blind person who might experience that if I was going to the polls.
That's a huge issue for people who are blind going to the polls, and just in general, just crossing the street is getting grabbed, because it's assumed that you can't get through the day without somebody grabbing you and guiding you, which is exactly not true.
Yeah, it's
and it does happen in the polls, and we had to train poll workers in New York City not to do that, to assume competence on the part of people with disabilities rather than incompetence.
Thank
We'll
you.
see how it goes.
Yeah, thank you. Renee, did you have anything to add to this topic on discussion right now?
Yes, I did. And first of all, I did actually fall. Someone bumped into me. I was using my crutches by Union Square in New York. It was either the very end of August or the first day of September. I can't quite remember. And it was hot. And somebody bumped into me. I fell down on the sidewalk. And I actually was okay. However, as the previous person so accurately pointed out, like more than a half a dozen people went to help me, grabbed me, and don't forget, it must have been 90 degrees. People were sweating, and people were, nobody had a mask. No one. And might I just say that led to my third COVID test, which fortunately came out negative. In fact, I'm going for my 7th tomorrow at the VA hospital. But could I add one thing about that? Because the whole idea of people coming to your aid, regardless whether there's a COVID or not, people do that. And I've often had to tell people, excuse me, can you please ask me before you do anything, how may I help you? And unfortunately, many people are insulted, actually. And it's too bad. But I wanted to speak to one thing, especially for people who use wheelchairs. This is happening in New York and other major cities where restaurants, Eddie, you and I just had a discussion on this, are setting up on the sidewalks or in the gutter lane of the street. And I can tell you, many of these are impassable.
Right.
And I might add, many of these people sitting at these tables on the sidewalk, they're eating. They're not wearing masks. And this is an issue that we are about to take on in New York City because it's really getting out of hand. I just went through a restaurant on the sidewalk on tables on both sides, people laughing, yelling, and talking. This is a danger to our health and our lives. And I would just like to stress to other people in other cities that this is an issue we really need to organize around. It is a priority. And basically, I have many times gone into the street, which is not that safe.
No.
But The irony is, it might be safer from contracting COVID. So it's almost like an internal contradiction. So
Hey,
thank you
Renee,
for letting
thank
me
you.
raise
Thank you,
this.
Renee.
Thank you so much, Renee.
Yeah, we're about 5 minutes away from the end of this program. I think we
Can
can
I,
one more question, Judy. Should I take?
yeah, can I throw one question in if it's okay? Because I
I'm
think it's,
seeing it in chat.
yeah, so Noel, this one has to do with Zoom. It was actually suggested by Susan, and I thought it might be a helpful question to end with. Because here we are on a Zoom call, and a lot of organizing and work is being done on Zoom now. And what are some, and we know that there are accessibility challenges, but what are some of the accessibility challenges now that do disabled people face because we're all in a Zoom environment? And we might have, that might have to be our final comment. So if you have something you have to say.
Correa knows a really good one, but I'm going to add, and that is for people who are deaf or hard of hearing, you need to have heart. If you're going to do Zoom, you need to have captioning. You need to have an ASL interpreter who is always on the screen, and speakers need to speak at a pace that an interpreter can interpret with. For people with low vision, it's important to send out the materials in advance. And that's true for people like me with brain injuries. I need to see all the materials in advance. I need to prepare. If somebody goes on Zoom and speed races through all these PowerPoints, I can't really follow. My processing time isn't as fast. So it's important to think about the speed with which you go through material and pausing to make sure people understand.
Yeah, I second what Susan said, because if you like, I have screen enlargement on now. I have my screen reader off. But a lot of times I need the screen reader if they have slides, because I can't read it because it's too small. But the screen reader is talking and the presenter is talking, and I'm sure Kristen can attest to this. And anyway, it's hard for me to hear the screen reader read what's on the screen, and then I'm listening to the presentation. So a lot of times I just lose out on anything that's slides. So I second that. And also presenters have to be cognizant. Like, I was on a presentation last night and she kept saying, well, get up and do this and do that. I couldn't participate in any of that because I wasn't prepared. Like, send us an outline or something, even if you don't know. Or for accessibility, if you have any accessibility needs, say that when folks register on the content you want people to join, so that we can be prepared about what's gonna go on.
Thank you, Tereya. I just want to, because we're running out of time, there was a question that was put in the chat. What action could I take to report something that isn't cool at a polling site? Is there a number or email to reach? And Susan responded, call the Board of Elections, Disability Rights New York, and the Human Rights Commission.
For that matter, there are disability rights organizations in every state.
Right.
And they are tracking, they focus on elections just like we do, and they definitely want to hear complaints, and so do we. We have a Facebook page, and we need to hear your complaints. And we have a helpline, which is for New Yorkers, so I don't want to mess up. This is a national audience.
A national call, right.
So can I also chime in? Like, if you see,
Yes.
if it's something inside the poll site, let the coordinator know. If it's actually the coordinator, call your local Board of Elections and say, this is going on at this poll site, the coordinator's doing this. But if it's something outside and if it's life-threatening, again, I hate the cops, but go on and get the police officer out of the polling site. Right. Or hopefully if you don't want to interact with the cops, go tell the coordinator, and then they'll inform the police officer.
Some coordinators are great.
I just have to kind of cut this short.
Not always.
Wait.
So
we have to wrap up, panelists.
No, but also I was just wondering if Kristen had any final words, because we haven't heard from her in a little bit. Kristen? You have to unmute. Yeah, there you go.
I'm on mute. Sorry, y'all. What was the question? Sorry,
If you
I
have any
spaced
final words,
slightly.
you hadn't added to this conversation, so this is it, the final words of the webinar. So do you have anything you want to add to this discussion?
Sure. Go out in the streets, organize, march, do whatever you can. If you can't do that, do stuff online, read some books, organize, learn.
Great.
The only way we're gonna get the society we want and the revolution we want, organize.
Great ending comments, Kristen. I just want to really thank all of our panelists. This has been an incredibly great discussion tonight, very lively, and thank everyone for your participation. Everything under capitalism takes money. Any amount that you can donate will help. We'll put it all into continuing the struggle to bring down this rotten, racist, ableist, and oppressive system. And you can donate 3 ways: at Venmo at Workers World. Our website is www.workers.org/donate, and through patreon.com WWP. And again, Patreon donations go to provide free subscriptions to our newspaper to incarcerated workers.
And from me, first of all, it's been an honor co-moderating with Betsy. Thank you so much, Betsy. And a big thank you to all of our panelists and to the incredible work of the Disability Rights Caucus of Workers' World Party for putting this webinar together. I would like to invite everyone to join us next week, Thursday, October 29th, but at our regular time, which is 5 p.m. Pacific time and 8 p.m. Eastern time, for a discussion with some of our younger comrades about how to prepare for the election defense, some of which we were talking about tonight already, how to organize and fight back against the racists and fascists, and how to push forward and finally win a workers' world. Good night, everyone. Be safe.
Good night. Thank you, Judy.
And
Good
if
night,
you're voting,
Thank you
if
so
you're
much.
voting,
Thanks,
early
everyone.
voting starts Saturday, the 24th.
Okay, okay, thank
Good
you.
night.
Good night.
Good night, everybody.
Great.
Good night.
Good night.
Good night.
Good night, everyone.